Things are changing inside some Colorado emergency rooms. It's not because of the pandemic, but because of a crisis that predates COVID. Here's Anusha Roy.
If you've ever told a mother or a father that they've lost their son or daughter to an overdose, that's a feeling that sticks with you. That's an experience you never want to relive again.
And yet it's a conversation Dr. Don Stater is having more.
We've had to have a lot more of those conversations about all types of mental health crises and substance use crises.
The opioid crisis intensified last year.
Twin tragedies in the COVID pandemic.
But today is to talk about how things are changing inside Colorado's emergency rooms, starting with the Health One system.
Anyone who's being seen with opioid use disorder or anyone who has suffered from an overdose. We also look at people who are using chronic pain meds.
And the providers here are making sure their patients leave with a naloxone nasal spray in hand that can reverse an overdose and save their life.
Emergency departments is one of the chief places people come when they struggle with opioid use disorder. We see patients with opioid use disorder more than anyone else in medicine.
Naloxone has been around for a while, and so has this idea.
However, no one's actually taken the steps to put it together and operationalize how to send people home with naloxone. And we're very proud to be the first state and the first conglomeration organization to look at this problem and say we can do it and we need to.
These providers want to cut the red tape because they realized people leaving their emergency rooms weren't always following through to pick up naloxone from the pharmacy.
If a patient is seen in the emergency department for an opioid overdose, there's around a 10% chance that in the next year they'll be dead, and around a 5% chance that they'll be dead within a month.
And for them, this work is personal.
I have friends who have children who suffer from this, and I think anytime I see the ability to put a medication like this in someone's hands, I think of an actual person who's going to benefit.
So the project has been in the works for 4 years, but it's launching now, and it's at a really critical time because, unfortunately, Jeremy, last year we saw record-breaking numbers for overdose deaths in Colorado.
You know, the stats that you're talking about here in your package are really startling. How many people have signed up so far?
Yeah, I mean, the numbers themselves tell such an incredibly heartbreaking story. And, you know, this whole project is being run through the Colorado Naloxone Project. Health One was the first one to sign up, but close to another 50 emergency rooms and hospital systems have now signed up to be a part of it as well, covering around 1 million people here in Colorado. The goal is to go beyond that. And Jeremy, I mean, an important question, right, is how all of this is being funded as well. And that's being done right now through a foundation as well as through the State Office of Behavioral Health.
Sounds like it's something that's desperately needed. Thank you, Anusha.